Hello, my name is Marian. Welcome to my channel. If you are new, welcome back to my channel. If you have been keeping up with these registry reviews lessons, in this lesson we are going to review the spine, and we're still working under the procedures or the sectional anatomy section for the test. So in this lesson, we are going to talk about the cervical spine, thoracic spine, lumbar spine, the pathology, when to use contrast and when not to use contrast. Make sure you know how many vertebrae is in each spine. Make sure you know there's 7 in your cervical, 12 in your thoracic, 5 in your lumbar, how many is fused in your sacrum, how many is fused in your coccyx, and know how to point it out or identify it, especially if you are working as a tech. You want to make sure that you are not clipping any anatomy for whatever vertebrae or spine that is ordered. You also have more anatomy for each vertebrae. Just make sure you know this. Make sure you know how to identify it on the test. It's also important to know what is the soft center of the intervertebral disc. So just make sure you know all of this information. This goes along with your anatomy review. If the doctor ordered a CT of the spine, it's mainly because of trauma, some type of disease or infection, inflammation, maybe a tumor was seen on a CT scan or a previous imaging scan. So you want to make sure for the doctor to know if it's benign or malignant. Even if a patient has had some type of spinal surgery, they'll probably get a follow-up exam, or if they had a spinal surgery and they're having back pain. And CT will be better for this due to MRI having a lot of metal streaks or artifacts. But I work in MRI and we scan metal in the back, in the neck on patients all the time. But textbook wise, it's saying that CT has less artifact than MRI. More anatomy that I have labeled for you all. If you want to just pause the video whenever you get to this point and review it. This is the pathology, common pathology for why a spine would be ordered to diagnose a certain type of disease. So just make sure you know this information and know how to identify it on your image. If you was asked, what is a herniated disc? What does it look like? So just know this information. You have more pathology, such as infections, inflammatory disorders of the spine. So it tells you why it is ordered. Whenever you are scanning your patient, ask them if they would like a cushion under their knees or another towel under their head for back support. Because when they come in for these exams, a lot of time they are in pain. So you want to make sure that they are comfortable so that they do not move. And this is pathology, like an illustration of how a normal disc look, what you would see if you saw a bulging disc, herniated disc. More pathology for you to review. Just know the difference between a normal disc, how it looks, versus a herniated disc. And whenever you get to this point, you can just pause the video and just review your anatomy like this. So when these spine exams are ordered, you will most commonly see the patient going in feet first with their arms above their head. You can put a cushion under their knees because their back is probably hurting. If you say cervical spine or thoracic spine ordered, the patient will most likely go in head first, but you can change the orientation on the machine. So if you do have to scan a patient head first for a lumbar spine, it's mainly because the patient may have a thoracic spine order with it, or it may be a patient that's in the ER and you want to just knock out the CT and L spine altogether instead of having the patient hop up and go back on the table feet first. You can just change the orientation of the body on the machine. Just make sure you do that, or your images will come out flipped. So you're gonna have to rescan the scalp or rescout it. So you also want to check and make sure that the order is with contrast or without contrast before you start and send the patient home. And most of the time, or I would say majority of the time, you would not give oral contrast for spines. So you don't have to worry about giving oral contrast. For spines, it's going to be IV contrast. So if I was scanning a lumbar spine, this is how I would set it up. This is just what I do. I try not to come close to any parts of the anatomy, especially if a patient is subject to move. I do not want to clip anything. So I leave a little bit of room for my SI joints on the sides, come down past the SI joint and the sacrum, and I always scan half a T12 because anything you're scanning, even if you're scanning the cervical spine, you still want to get half a T1 in there. If you're scanning the thoracic spine, you want to get half of C7, half of L1 in there. So this is just how I will set up my lumbar spine. Know the difference between bone windows and soft tissue windows. Here is an example of how it looks. And a lot of times you have to send soft tissue and bone windows to the radiologist. More anatomy I was telling you about. This is how it was set up for a cervical spine and how I was scan it. Make sure that you are getting C1 in there. Do not clip that. I always scan down to mid T1. So whenever you come to this video, you can just pause it and just use it as a anatomy review for you. When contrast is ordered, um, it's not routinely ordered for spines, but when it is ordered, it's to check for cancer, a mass within the soft tissue, infection, maybe an abscess. If the patient has had prior spinal surgery, you may want to use contrast. If they're not allergic to it, um, and some type of example I just put here, you do not have to use this. It's going to vary patient to patient age. So if a patient came in, you can start the IV anywhere because it's not going to be an angio spine. It's just going to be a regular spine. So you can have an 18, 20 gauge. You can even use a 22 gauge for this. It can be anywhere in the hand, the wrist, AC forearm. It doesn't matter for a CT spine exam. You can inject at 2 milliliters, 1.5 milliliters if it's in the hand or the wrist. So just follow your facility's guidelines on the appropriate age when you're giving these contrast studies. Because another thing, you do not want to give 150 milliliters of IV contrast to someone who weighs 75 pounds. That's too much. So just follow the age and the body weight for your company. This is a thoracic spine. I always scan mid C7 down to half a L1. The patient is going in head first. Be sure to tell the patient they will have to follow breathing instructions. So if they speak a different language, make sure you change it so the patient does not move. And it's hard to count a thoracic spot if you're just looking at it like this. So that's why you have to know your anatomy, have to know where is C7 to make sure that you're getting T1, where is L1 to make sure that you're getting T12. So just know your anatomy. Well, this is it. I am at the end of this lesson. We just covered the spine. You can also use it as your anatomy review because I added that in there. Um, if you would like to, leave me a comment. Let me know if you scan spines a lot. Let me know if you're comfortable with your anatomy for the spines. And also let me know if you're using this as your CT registry review. your CQR review and you know all of this information, this is just to brush up on what you may be asked. Let me know if you are a student or if you're just thinking about learning CT and you're just watching these videos to get an idea. Well, I hope you enjoyed this lesson. Stay tuned for the next one. Thank you. Bye.